Hello, everyone, and I'll be presenting the findings from our infant HIV exposure screening intervention implemented in Nigeria on the CDC-funded FASTER project. So FASTER represents the faith-based action for scaling up testing and treatment for the epidemic response, and this was targeted at accelerating pediatric case finding, linkage to treatment, and retention in care. Okay. I have no disclosures. So in Nigeria, the PMTCT and EID coverage has remained low. So one of the interventions on the FASTER project was to demonstrate the impact of infant HIV screening using an age-appropriate risk screening tool across non-PMTCT entry points, such as the inpatient, outpatient, immunization, and nutrition clinic. And the aim of this was to actually improve case finding amongst women and their infants and promptly link them to treatment. So the implementation was conducted from July 2020 to December 2021 across 57 sites in 8 states. And we determined the eligibility for infant HIV testing by assessing the maternal HIV status, infants presenting without their biological mothers, history of blood transfusion, among others. Overall, about 36,500 infants were screened with this tool, and over 1,800 high-risk infants were identified. And this includes infants that were born to women who were referred for tests and newly identified to be HIV positive, and those also indicated to have other risk factors. So in this strategy helped us to identify over 705 women living with HIV and 135 positive infants who may have otherwise been missed without this strategy. And below on the right side is just a snapshot of the tool that was used. So in summary, the infant exposure screening strategy was viable in identifying new positive amongst infants and then women. And it's critical that this should be scaled up just so that it can improve the prevention of vertical transmission achievements, accelerates pediatric case finding, and linkage to treatment. It's critical to also integrate the HIV screening for children across as a routine practice across different units within a facility. So future implementation should consider capacity building of healthcare workers outside of the HIV clinic, just to optimize the strategy and also to improve uptake. And country programs can also consider to develop specific risk screening tools for pediatric and adolescent patients, just so as to increase the sensitivity to identify more at-risk infants. For more information about our study and our intervention, please feel free to stop by at our poster stand 23. And I would like to acknowledge the government of Nigeria, the healthcare workers that supported this work, CDC for funding this work, and my colleagues for also implementing this, and to you, the audience, for listening. Thank you.